Good afternoon everyone. I am Nisha Khimire, teaching assistant from Nepalganj Nursing Campus. Today we are going to discuss regarding the ethical aspect in nursing. So we are going to discuss regarding meaning, ethical principle in nursing, and at last we will discuss one clinical scenario. Let's start with the meaning. So we are seeing some picture over there. The person is holding two options, either right or wrong. The basic meaning of ethics is either doing right or wrong. Or in nursing field, the ethics refers to the moral code for nursing and is based on the obligation to service and respect for human life. In clinical scenario, there will be so many situations where nursing have to follow the ethical principle to provide the care which will benefit the patient. According to Sister Nancy, ethics are the rule or principle that govern the right conduct and are designed to protect the right of human being. So, nursing practices should protect the right and provide safety to the patient. Let's discuss regarding ethical principle. Before moving to other principle, we are seeing the picture. The client is undergoing the blood transfusion, and there are the side rails are up, and the nursing is holding the patient hands, is providing the comfort, and the patient seems all right. So there will be so many procedures like this, and nursing have to follow the ethical principle. So let's discuss one by one. There are the first one is autonomy. Auto means self, nomos means rule. According to autonomy, it means the individual is capable of making his or her own decision. So, as a nurse, we have to provide the information regarding any surgical procedure, treatment, or any investigation. We have to say the advantage and disadvantage of particular procedure, and let the client or patient decide it. So, best example is informed consent. Okay, for example, the patient is undergoing any surgical procedure, they have to sign the informed consent. In informed consent, it will be provided all the information regarding surgery procedure. Next one is benefit, to do well. Okay, any of the nursing procedure must benefit, provide kindness and goodness to the patient. For example, raising of the side leg will prevent the patient to fall from the bed. So checking out the expiry date will prevent patient from the side effect. Next one is non-maleficence. That means we should not do any harm. For example, means if you administer expiry date medication, what will happen means that it will cause harm to the patient. Harm means not only the physical, it will be mental, social, financial, physical harm. So the patients will be free from any kind of the harm. For example, if you forgot to do the cross matching, or if you administer wrong BT to the patient, it may land up to the patient death, or they may have to go for a dialysis. Next one is veracity. The simple meaning of veracity means to telling of the truth. So we have to give the factful information to the patient. So it has got two opinions. In Eastern Western culture, it will say that we have to say everything information, we have to provide all the information to the patient. But in Asian culture, what it is believed that some of the information may cause harm to the patient, so that's why we have to withhold for the some time. Next one is justice. So regardless of any age, sex, any income, poverty, we have to provide equal treatment to the patient. Next one is, and last one is fidelity. Fidelity means telling truth or keeping up the promises. For example, there is a patient, you are giving some care, and you have to go to there will be an emergency in other patient, then you will say I will be back in 5 minutes, then you have to go and meet the patient again in 5 minutes. We should not forget that. So let's discuss regarding one clinical scenario. This is for your assignment. There is one patient